Hey everyone, Dr. Rodman with Sports Chiropractic, and I just want to share with you my recent case of tendinitis with myself and my new appreciation for how severe tendinitis pain and limiting in your function it can be. So it all started with last Monday. I had a chest day, pretty heavy chest day, nothing abnormal, and felt fine, didn't feel any injuries through it. Tuesday came along, I felt a little bit of tightness in the pec area, but nothing severe, just normal for a heavy chest day. That day, I helped coach my son's little league team and was throwing a lot of, pop-ups to the kids, and nothing abnormal, didn't have any pain, but progressively, by Wednesday it was a little sore. I work for Florida Atlantic University, I'm their team chiropractor. Last week, we had a football game, so I had to treat the athletes during the week at school, at their hotel before the game, and on the sidelines. So it was a little heavier of a workload for me, and I'm working on 200-300-pound people and adjusting them, and I felt some sharpness in the shoulder with that as well. Also had to test out some clothes for Lululemon and do a workout in them, and we were doing some fun stuff. We were carrying each other over our shoulders and just interesting things that I don't normally do, but all of that stuff added up. It wasn't one specific trauma, and that's what I'm trying to talk about today, is that it's not always in one specific injury, but it's a lot of little things that add up, and you're like, oh man, where did this come from? So by Friday, I could not raise my shoulder more than 70 degrees without pain. It was in constant pain. I couldn't sleep on it. It was just so sore. I had a hard time getting through the day of adjusting people, because you have to kind of put them on your side and adjust. And every time I did that, it was a sharp pain here. I was really nervous. I never had shoulder pain before. Saturday came, and I was very thankful that Rocktaping had their Rockstock movement summit in Miami, Florida, and I was going to that, and there was a lot of vendors there, and I was able to get some laser on there. There was a Hyperice was there, and they have their Hypervolt vibrating percussive massager, which is an awesome thing. We'll do another video on that, but I bought 3 of them, and it really helped me as well. And also I bought some rock pods, which are the cupping instruments from Rocktaping. So I was able to treat myself, and by the end of the weekend I was maybe 25% better. But I was a little bit hopeful that it was gonna be okay, but I still couldn't really raise my arm without pain. I couldn't drive without pain. Little things, couldn't sleep on it. So Monday comes around, this past Monday, and in our office we do ultrasound here, diagnostic ultrasound, the same thing that we do on babies, but we do it here to look at bones, muscles, ligaments, nerves, things like that. So I did an ultrasound on myself, and I was very nervous because I thought I would find possibly a tear, maybe a rotator cuff tear, and I know from treating those how catastrophic they can be, how the surgery is tough and the rehab's tough. And as a chiropractor, we need our shoulders, and I've never had a shoulder issue ever. Thankful to say I've had many other issues, but not the shoulder. So I did the ultrasound, and I was very pleased to not find any tears. I did find some subacromial bursitis, a little bit of an inflammation in the bursa that's right underneath this bone here. And I did find a pretty inflamed biceps tendon right through here. And that would make sense that every time I raise my arm up, it would kind of get smushed into the roof of the shoulder, that acromion bone, and just cause some severe pain. So very happy about that, to find that it wasn't a tear, that it was something treatable, and it gave me the exact direction or the roadmap of what I can do to treat myself. And it got me thinking though, what if I wasn't a sports chiropractor? What if I did not have any knowledge on how to help injuries? And what would I do? I would be lost. I would be very lost. It would probably be something that would linger on for years if I didn't go to the right person. And it just made me think that there's so many people suffering with tendinitis, which is painful. They have to change their lifestyle around. They can't do common daily household things or lift their children or perform their sport or their job. And what do? A lot of them may get an anti-inflammatory type injection, but that doesn't fix and restore the area, and the problem will just come back again. So I just wanted to share my story with you guys today, hopefully shed some light on possibly seeing someone like me, a sports chiropractor. Think of us for tendinitis. I know a lot of people think of us for headaches, neck pain, back pain, which there's tons of research on how chiropractic is the first line of defense for back problems and disc issues. But tendinitis, I don't think there's anybody more qualified to treat it than a sports chiropractor, or maybe a sports, physical therapist that's doing some manual therapy, because also tendons, it's not an easy treatment. You kind of have to be a little bit nice to it, because you can keep inflaming the sheath of the tendon if you're doing a lot of deep tissue, and really there's nothing to massage in that area. It's like a steel cable. So we want to do some things around the area to loosen up the tension on that cable, but we don't want to over compress it. So there is a specific touch and a specific treatment for tendinitis, and I just wanted to let everyone know that if you're suffering with tendinitis, or if you have a family member or a friend that has lost their ability to function because of tendinitis in anywhere in the body, definitely the shoulder, but anywhere in the body, think of us, Sports Chiropractic and Natural Health Solutions, Dr. Todd Rodman. We can help you. If you're in another city, please email us at the email address here. I would love to help find someone near you that does similar techniques to us and can help you out as well. You don't need to live with the pain anymore. I'm thankful to say I'm probably about 80% better. I have full range of motion. It's only been 3 or 4 days since I've had that severe pain, and I'm already feeling very confident. I'm already working out again. And that's another thing that we can do as sports chiropractors, is educate you not only on what we can do for you, but what you should and should not do outside of the office here. And that's very important, because if you keep aggravating it, it's not going to heal, or it's not going to heal very quickly. So let's get rid of tendinitis. Anybody has that, please give us a call. Think of us. We should be the first line of defense for your tendinitis issues. Dr. Rodman, have a great day.